Thank you very much, Mr. Chairman. In the interest of time, I ask my entire statement be put in the record. And I want to thank you and Senator Murray for holding this hearing and Senator Cochran for being here. I'm going to get right to my question. But I think what this shows is, once again, that the defense of the nation doesn't only rely on DOD. You know, we might be fighting ISIL with airstrikes, but we could be protecting America with mosquito eradication. And we need to be able to be prepared, and we need a reliable infrastructure along the way. But Dr. Frieden, I'm going to go right to you. The president is asking for an urgent supplemental. The numbers have been explained and so on. There are others who say, hey, Tom, you've got the Ebola money. Why don't we just reprogram that? You've helped the world contain that. America's acted once again. And yet when I spoke to you, you were on the edge of your chair about the possibility of reprogramming, and also that we would be very dithering in the way we proceed, and you had a sense of urgency, particularly over the next couple of weeks. So could you say why you need a supplemental according to the definition of urgent, sudden, and unforeseen, or should we reprogram the money?
Well, first, the situation is urgent because we are learning more every day. We already have seen more than 24 locally acquired cases in Puerto Rico, so we may see rapid spread through the island, and we need to respond urgently. It's certainly sudden. This is something which, until late last year, no one had any idea that a mosquito bite could result in a serious fetal malformation, and it's unforeseen. We have actually never before had a mosquito-borne cause of malformations, as far as we know, on a major scale. Our Ebola supplemental, we are deeply grateful that Congress provided that. That allowed us and allows us to continue to respond to the Ebola outbreak. In West Africa, we continue to have about 100 CDC staff on the ground. Last month alone, we did 10,000 tests for Ebola to identify a new case of Ebola and a new cluster. We then responded to that cluster of cases with intensive contact investigation of more than 100 high-risk contacts. Very challenging environment still. So first off, Ebola isn't over. Second, if you look at the dollars for Ebola, those dollars are fully committed. Within the U.S., the budget was about $600 million. By the end of this year, more than 95% of that will be gone. In the 3 affected countries, we had budgeted $300 million. By the end of this year, we will spend at least $300 million in those areas. For the rest of the Ebola supplemental, it's about the global health security work. And for global health security, this is about finding things like Zika before they become problems like this. This is finding threats when they first emerge.
So, Doctor, what you're saying is the Ebola money is actually committed, that it is not a pot of money we can turn to and move around in like a fungible way to deal with Zika, that we have to deal with Zika on its own. That's number one, to immediately be able to respond, because Puerto Rico, as you said, 40 million people are traveling back and forth. We don't know the full extent of the disease. Dr. Fauci's also spoken to that. We don't know about the impact in people over 65. We're talked about pregnant women, really quite a eye popper in and of itself. We don't know about the impact on people with compromised immune systems. We don't know that. We don't know a lot. And we don't know about the long-term consequences. And you mentioned chikungunya, a new thing to me, but the effects of this last 10 months and simulate like arthritic conditions and could leave long-lasting consequences. So we need to get over that there are pots of money sitting around, am I right, that you can move around. We have to deal with this now. And also say for CDC and NIH, we need reliable infrastructure, ongoing. Am I right in this?
Absolutely,
I don't want to put words
Senator.
in your mouth.
Yes, absolutely. We
You
don't want to
conveyed a
let
pretty
down our
big
guard.
sense of urgency to me.
Absolutely correct, Senator. Thank you very much for those remarks. We do need urgently to both not let down our guard against the threats we know and strengthen the systems so we don't always have to address things that we might have been able to find earlier.
Well, my time is up, and Dr. Fauci, I could ask you so many questions, but I remember 30 years ago, you and I kind of began together. We've been on a very long journey together, and when men began to die, particularly in their West Coast, and we didn't know what was going on, we turned to CDC because you are our bio detectives, and then we turned to NIH. The rest is history. It's a history we can be proud of, but we need to be proud of the fact now we need a reliable infrastructure that you are turning to, the basic research. From our conversations, you'll be looking at the institute that does research on the brain. You'll be looking at the institute that looks out for maternity and child health. You're going to be cutting across NIH, and you just can't keep moving it around. Research dollars are committed for the long term. Am I correct?
You are correct.